I would say that while the pandemic has universally changed normality for everybody, it is not the great equalizer that some have claimed. In New York City, those with second homes packed their cars and fled the city, leaving empty buildings and quiet streets behind. By contrast, those who have remained largely fall into two categories. The first would be those who could and began to shelter in place relatively safely and avoiding the infection while working from home. And the second are those for whom sheltering in place meant that they had to continue exposing themselves on a daily basis because their jobs were such that they were suddenly deemed essential. These individuals don't have the luxury of continuing to earn an income in the safety of their own homes. Their jobs are essential for the survival of the city, yet these workers are still earning minimum wage, which is a direct message from society that clearly tells them that they are disposable. These workers include our grocery clerks, our bus drivers, our maintenance workers, the delivery people, and healthcare workers. Not coincidentally, they are also disproportionately Black people, heavily comprised of immigrants and women, and they make it possible for wealthy white people to stay safely in their homes. In New York City, frontline workers represent approximately 25% of the overall workforce, yet 79% of our frontline workers are Black and Latino, and approximately 63% of them are women. Overall, they represent about 62% of the fatalities in the city. They're generally underemployed, make the lowest wages, and lack access to adequate health care. While the data from the current crisis points to irrefutable disparities in infection and death rates in these communities, to me, the most compelling case that those numbers make points to the deep-seated, underlying, and long-standing structural patterns of inequities and disparities. It also highlights some of the tensions that have existed throughout the history of this country between individual rights and the good of the community at large, which can be seen most directly in the current protests against closures that have been implemented as public health protections. Those arguments for personal liberties are often invoked by white people at the expense of Black communities. The rush to reopen without appropriate measures in place would sacrifice Black people at the altar of the United States economy. But individual rights and self-interest are not enough, and a failure to recognize our interdependence now runs the risk of incurring a second wave of outbreaks that will prolong our ability to recover overall. The pandemic of racism existed in this country long before the pandemic of COVID-19. The pre-existing social conditions, if you will, that are reflected in the lack of access to affordable housing, employment that allows for economic stability, quality education and healthcare. These things are part of the aspects of the social contract that Charles Mills has referred to as the racial contract, whereby the same rules and freedoms that apply to whites don't apply equally to non-whites. And there's an underlying assumption of white innocence and Black guilt. That also can be seen in the differences in how communities are currently being policed, where Black people are being brutalized for failing to exercise social distancing, while their white peers in crowded public spaces are being provided with masks instead. The curtain's been pulled back on the myth that the rules have applied equally. We've not actually all been in this together. I heard someone say recently that we're in the same storm, but we're not all in the same boat. Moreover, this crisis in particular has highlighted the extent to which the individual pursuit of happiness is inextricably linked to the collective. But there's a transformative potential in this crisis, I believe. This is a moment where we can create a new social contract that rewrites the narrative on how we begin to address the deeply ingrained racial inequities and inequalities and move towards a New York City where everybody can truly have access to the opportunities that they need to fulfill their potential. I think it's up to us to determine whether we choose to see that and what we decide to do about it.